Good morning, everyone. This is kind of it's a day of celebration, first of all, but it's also bittersweet. It wraps up our COVID-19 Health Disparity Grant that all of you had such an important role. And I want to welcome all of you, and I really want to begin by thanking all of you. This has been a tremendous journey. We have made some amazing inroads when it comes to health inequity and people with disabilities. And just thanks for all your, um, you know, I'm trying to find the right word. Really, just thank you for believing in us, that the Arc of Pennsylvania was able to lead this, but it wouldn't have happened without all of your amazing input. So just a quick recap, this is a picture of our barriers and solutions report that we submitted to the Department of Health. We are receiving disability inclusive healthcare is gaining attention, I should say. We're gaining action. Still much left to do, as we were saying yesterday, miles to go, but what is so exciting is that this work with your input and your help really has elevated the voice, and we're very proud of that. This is just one example of elevating that voice. This year, we attended and participated in the Disability Community Strand at the 2024 PA Health Equity Summit, Joy and Justice. This was such an amazing thing to see, that there was actually a strand now for disability. And we took part in one of the panel discussions. So this is just one example of the many opportunities that we have had to talk about the grant, talk about our findings, and once again, elevating that voice of the disability community as it relates to health equity. This is another elevation. So Perry Jude, and this was last year's Healthcare Power 100. And we have had some folks who have been involved with us. Perry Jude was recognized for her leadership with disability rights. She is the CEO, and efforts to combat COVID-19 medical rationing. Perry Jude also spearheaded to fight budget cuts that impact the people with disabilities and urge greater ADA compliance. So thank you, Perry Jude. We have Paul D'Angelo, who is the CEO of Mission Autism Clinics. It's a nonprofit organization which supports children and families with autism. We have Jill Bowen, Dr. Jill Bowen, who has been the Commissioner of Philadelphia's Department of Behavioral Health and Intellectual Disability Services. And so she was recognized. And then I was recognized, and it was really due to this work and all of our work. So just wanted to recognize the group who has been involved in this, that's also being recognized by city and state. This year, we have more trailblazers. So we have Lindsay Malden, who is with the governor's office. Lindsay has been a tremendous partner in all of this work, and we were very glad to work with her. Jim Sharp, who is with RCPA, he does a lot of work in the behavioral health space as well as early intervention. And I was recognized really again for the work that you've been doing. And I just have to say that, and I've said this many times, that really the recognition with my face on it is really the recognition for all of you. This would not have been an opportunity. They would have not recognized this without the work that all of you did. And so this really is for all of you, that we've been recognized as trailblazers. and very proud of that. Here again, it's a little embarrassing. Rhonda and I were not sure like who was going to handle these slides because it just seems a little weird that I'm elevating all of this, but this award was so impactful. So we were recognized by the National Network of Public Health Institutes, and we received the 2024 Strengthening the Public Health System Award. This one's for the team, right? This was a recognition of all of our work again. It was very interesting and for me to be standing in a room of about 600 people, and they're all public health professionals, mostly, a majority of them, but we were really the only people in the room talking about people with disabilities as it relates to a public health issue. Very proud of that. And had the opportunity to remind everybody that when we're talking about public health, that we cannot forget the voice of people with disabilities. So thank you, all of you. This is really your award too. So very humbled to be representing all of you. Rhonda, I believe, do I stay or do I keep going or do you take over?
You can keep going.
Okay. Yeah. You know, everyone, we do rehearse these things the day before, but I often get lost in the details. So um, I'm not sure if everyone is aware, but Section 504 of the Rehab Act, the final rule just came out. I know that I think of Perry Jude, and Perry Jude, I'm going to put words in your mouth that you're probably thinking, oh, this was really done during ADA. Why are we redoing it again? Who's going to enforce this? But this was the final rule based on the discrimination on the basis of disability in health and human service programs or activities. This is receiving a lot of focus right now for our work with Disability Health Action Network, but we wanted to bring it forward for all of you as well. And we have a brief video that we would like to show everybody. So I'm going to turn it over to whoever's handling that. We don't have audio.
We'll go to Nancy.
Hello, I'm Melanie Fontes-Rayner. I'm the Director of the Office for Civil Rights at the U.S. Department of Health and Human Services. Nearly 50 years ago, with some help of incredible advocates in the disability community, Section 504 of the Rehabilitation Act was signed into law. Unfortunately, in the 5 decades since, it has sat barely updated. That's why today, my office is thrilled to be issuing a final rule updating and modernizing Section 504 to advance the promise of the Rehabilitation Act and help people with disabilities from experiencing discrimination in any program or activity receiving HHS funds. By removing barriers to critical health care and social services, this rule advances justice for people with disabilities who have been too long subject to discrimination. We at OCR believe deeply in this rule because no cancer diagnosis should be missed because of an inaccessible mammogram. No patient should be left with questions about critical test results due to an inaccessible website, and no life should be valued less due to a disability. To that end, this rule first ensures that decisions about medical treatment are not based on biases or stereotypes. We received complaints that throughout the COVID-19 public health emergency, discriminatory standards were used to determine who received life-saving care, such as ventilators or treatments. And that's not okay. Second, for the first time, this rule implements a standard to ensure non-discrimination in the use of technologies that are routinely used in healthcare, including web content, mobile apps, and kiosks. For those of us who have gone to a lab or an urgent care or an emergency department, kiosks and mobile apps are widely used, but they are not always accessible for persons with disabilities. Third, this rule establishes standards for accessible medical equipment that OCR can enforce under the law. Too many people are unable to access equally effective medical care. This update will mean that women who have never been able to have a mammogram or pap smear because no provider in their area has accessible medical equipment will finally be able to access this care. Fourth, this rule prohibits the discriminatory use of methods and analytics that place a lower value on the life of a person with a disability. Fifth, the rule clarifies that the prohibitions on discrimination on the basis of disability apply to child welfare programs. This rule aims to eliminate discrimination against children and parents with disabilities. The reality is, my office receives complaints about unnecessary removals of children from parents with disabilities based on the Child Welfare Agency's discriminatory stereotypes about their disability. Finally, this rule clarifies that recipients must provide services in the most integrated setting appropriate to the needs of the individuals with disabilities. People with disabilities have a right to live and receive services in the most integrated setting, to live in their homes and communities instead of in institutions. HHS and OCR are here to help protect you and your access to health care, because all people deserve health care that is safe, accessible, and free from discrimination. To file a complaint or to request a complaint package and learn more about the protections of Section 504 of the Rehabilitation Act, visit hhs.gov/OCR. Thank you.
Powerful and hopeful, right? So we will continue to work with our partners around the 504 accommodation. We need to celebrate all the attention and the important advances since our barriers report. And really, here's the expression of miles to go with the recommendations from our recommendations report. 3 years seems like a flash, but it is still amazing to see some of the issues that we were talking about in those very early meetings with our barriers report. We're already seeing movement in our solutions report. So it's all to you. I mean, this is really a day of celebration, and I think we all need to do a little patting ourselves on the back. Next phase. So we wanted to make sure that the solutions report wasn't just published and put on a shelf. So we were very anxious to continue the work, and we came up with this next phase, which is called the Disability Health Action Network. And this is going to be a statewide collaborative committed to advancing health and well-being of individuals with disabilities in Pennsylvania. Our tentative model, as you can see here on the left side of your screen, it is the model will have an advisory committee, and there underneath are our pillars. These are our areas of focus as it stands today. We're just now getting into it. So we hope that there'll be opportunities for all of you to continue participation in some role. I'm going to, oh, here we go. So Disability Health Action Network, or we're calling it DON. So it's networking. You know, this is what we saw. The networking part of it was very successful during our regional community work groups, during our listening tours, and we want to continue that. Hearing the voice of people with lived experience, I think, was one of the most impactful parts of our work, and really establishing those boots on the ground through regional community work group participation and the leads who are on this call today, because we knew when we wrote the grant that we wanted to be able, that change occurs in communities, in your backyard. And we wanted to be able to set that network up on local levels and start those conversations. So we'll be maintaining our partnerships with you. We'll be sharing information, and we will also be collaborating with all of you to continue our work in the disability inclusive healthcare. We have our Disability Health Action Summit coming up on March 19th, 2025, same place at the Sheraton Harrisburg Hershey. We hope all of you will join us. We are putting together what we think is going to be a really robust schedule. We are also looking at including vendors this year, so you'll be receiving more additional information as we get more details. So once again, it's a network and it's collaboration. And I think, we use that word a lot. We use the word collaboration a lot, but I don't think there's probably a better example of collaborating than this group here and the work that we did. I'm going to turn it over to Rhonda Beach-Tyree, who is our facilitator and really who has been our guide throughout these last 3 years. I truly believe that we would not, an internal team here, we would not have been as organized and as successful without her leadership and her insight and her guidance. And Rhonda, I just want to thank you so much for all that you've done and will continue to do working with the ARC as we go forward with this project.
Thank you, Sherry. Hello, all. I'm also mother of that handsome young man, Tristan. Today's agenda, we're so excited to have Gabrielle Grode with us from the Public Health Management Corporation, Gabrielle, thank you, PHMC, to share evaluation findings with us again. I'm excited to share that. And then we have a few highlights from some of our regional community work groups, Maureen and Michelle and Darylyn and Sally Jo and Shane. Thank you for all you've done and for sharing a few of those activities today. And then Brian and Sherry will help us close with more acknowledgements of the work. Let's turn to you, Gabrielle. So glad you're with us.
Thank you. I'm going to share my screen. So just give me a second here. Okay, are you seeing the slideshow? Okay, great. And hold on, I'm going to pull up your faces so I can see you. Actually, you know what? If my presentation is showing on my other screen, if my face is turned, is that jarring for people or is that okay? That's okay? All right, great. Well, what a fun meeting to be a part of today, the celebration and the recap and the honoring of the work that you all have done. It has been a privilege for me to serve as an evaluator on this project. I've learned a ton, and I could just feel the passion of all the people involved in this project. So for me, it was very inspiring. So thank you for letting me be a part of this. My name is Gabrielle Grode, and I'm the Senior Project Director at the Public Health Management Corporation within the Research and Evaluation Group. We're based in Philadelphia. And I'm here today to talk about some of the main findings from this evaluation of the work that you all were involved in. So I'm going to focus specifically on the partnerships, the statewide task force, and the regional community work groups and how those partnerships functioned and the success of the partnerships. So let's see how to advance the slides. There we go. Okay, so this is likely recap for all of you, but this was, besides all of the partners that you all were involved in, which was in the hundreds, the evaluation had several different partners as well. So there's the Research and Evaluation Group at PHMC. Of course, the ARC of Pennsylvania helped us create and develop and implement the evaluation. The Pennsylvania Department of Health as your funder. The CDC is where the parent funding came from. And then, as Sherry mentioned, the National Network of Public Health Institutes gave you an award, which I didn't know about, and that's amazing. They were also funded by the CDC to facilitate the evaluation process for a select number of projects that were funded by the CDC through this grant. So your project was one of only a handful of projects that were selected even to be evaluated. So that in and of itself, I think is something to recognize. And the National Network of Public Health Institutes, or NNPHI, gave us money and funding and partnered us with the ARC of Pennsylvania to do this evaluation. So just quickly about PHMC, the Public Health Management Corporation. We are a public health institute and a member of the National Network of Public Health Institute. We're a big organization with, locations throughout the area, more than 350 programs, and we're, we just span the public health spectrum. We have federally qualified health centers. We are intermediary for foster care services, health promotion services, and research and evaluation is one of the divisions at PHMC as well. So this is the group of evaluators that worked on this project. Kohei Akiba, Etta Akpek, Lola Al-Akda, myself, and Margot Weisel. And we had a great team working on the project. And as I mentioned, the research and evaluation group sits within PHMC, and we are like a full service research and evaluation consultant group. And we do evaluations and research and technical assistance and all different types of methodology that also spans the public health spectrum. Okay, so that's mostly the background. Any questions or anything before I keep going? Rhonda, you help me if people like raise their hand or, okay. So I was gonna have Sherry give a few highlights of some of the work that you all were involved in, but she already did that. So this slide just represents some of the main accomplishments and activities of this multi-year initiative and effort that you all were involved in. And this slide may be a little overwhelming, but for us to convey to the CDC and the NNPHI what this partnership looked like and what was happening in this partnership, this was an image that we used throughout the project in our various presentations and reporting to those two entities. And so what you all know this because you've been involved in this, but what I've highlighted in those other in those other meetings or reports is the magnitude of this effort. So at the top box, you see the statewide task force that represented 31 members in 23 different organizations. At the bottom, you see the regional community work groups. There were 13 work groups with 224 members across 155 different entities or organizations. So just the sheer size and magnitude of this effort, I think is really, noteworthy. The other thing, and then, the ARC of Pennsylvania is in the middle as sort of a convening conduit. And the colored boxes, just so you're oriented to the image, are some of the main activities of the various partnerships. The blue arrows on the outside represents the feedback loop between the regional community work groups and the statewide task force. And that is something else that is noteworthy about the initiative, that you were working in concert with each other. And that's how we came to understand the work. So I hope that's resonating with all of you. So just appreciating the size and the effort of this. So we worked with the ARC of Pennsylvania to identify what were our main evaluation questions that we wanted to uncover through the evaluation. So we had 4 main questions, which once we were convened with some of the other evaluations that were happening in the funding mechanism, I realized how much we were doing. A lot of folks just had one question that they were assessing, but we were just, there was so much to think about within this partnership. So we were looking at how effective was the initiative in developing new and strengthening existing partnerships, to what extent the initiative increased partners' capacity to address disparities, what barriers and facilitators impacted the partnerships, and how the ARC of PA modified its efforts to fit different accessibility standards. And today, I'm going to touch upon the first, elements of some of the first three questions. The last one we won't get into today, but there is a report available if anyone wants to read extensively on these things. The report itself, and just to I'm going to try to breeze through and give you a high level summary of some of the findings, but the report itself is more than 30 pages. We had almost 100 pages in appendices. There was just a lot that we uncovered and evaluated. And so if anyone is interested, you can go through all of that. But my job here is just to hit some highlights today. So those were our main evaluation questions. Each evaluation question had sub-questions, and then there was the data that we used to answer these questions. So in this evaluation, we used both secondary data, so that's data that had already been collected through the partnership or was already in existence, and then we had primary data, which consisted of interviews. So you can see listed on the slide who we conducted interviews with. We talked to folks from the ARC of Pennsylvania, regional community work group leaders. I'm sure some of you are here today, as well as regional community work group members, and then statewide task force members as well. And the numbers in parentheses are the number of folks we talked to. So in total, we spoke to 16 individuals. So that's like a snapshot of participation in the initiative. And then secondary data. So even though you weren't initially conducting an evaluation and maybe weren't thinking about data collection, you all collected a wealth of data that helped us do our job. So there were attendance logs we reviewed. We looked at task force meeting minutes. We reviewed progress reports and your organization initiative reports. We looked at the media usage reports, which we won't get into today. The last bullet point there, we looked at the products that you created, and then we did, the R&E group did an online organization scan, which basically meant we looked at all of the organizations in the partnership at your websites and gather data on your service area, your geography, the populations that you served, the COVID outreach or whatever COVID work was happening, and kind of made our own data set around who was involved in this partnership. So one of the questions within those main evaluation questions that we were looking at was how diverse was the statewide task force? So this is what I'm showing here is diversity by sector, but as Sherry was talking about, there certainly was also diversity by role, by lived experience, by geography, by other elements as well. This slide is just looking at sector. So 51% of participants in the statewide task force were in the nonprofit sector, and then you can see healthcare, government, and education. And one of the things that we looked at, which I think is so important, was that 65% of these statewide task force partners were new to the ARC of Pennsylvania. And the reason I call that out is because one of the goals of this work was to break down silos and bring in different folks from who you usually talk to and who is usually partnered with. So for 2/3 of those partners to be new is really incredible. Here you can see, oh, and this data came from our organization scan, but here you can see the diversity represented by sector in the regional community work groups. So 1/3 were advocacy and nonprofit organizations, government and healthcare were about 20%, and then you can see the other sectors represented there as well. And it mirrors to some extent what you see in the statewide group, but there were so many more participants and organizations in the regional community work group, so there's a lot more detail and a lot more diversity. So here, 74% of partners that the work groups brought in were new partners, 74%, 3/4. All of the healthcare organizations were new, same in the statewide task force. So that was one of the main goals. I think you can say that you achieved that goal. And I just think that's really noteworthy and something to pause on. Rhonda, you have this nice smile on your face. Is this surprising to you, or something you knew, but maybe you didn't know it in numbers yet, or?
I'm crediting the regional community work group, our coordinators and outreach for building those partnerships. They are so important, Gabrielle, and it just brings me joy on their behalf.
Yeah. And I'm sorry if I'm speaking quickly, but I know that there's many more items on the agenda. So, okay, just let me know if you need me to slow down a little. Okay, so let me orient you to this map. There's two things being shared in this map. One is the yellow dots, which represents the locations of the statewide task force organizations. So that's just the actual address where they reside. The statewide, most of the organizations in the statewide task force served the entire state, not all, and some served beyond their state, like multi-states, okay? The shading, the blue shading, represents the number of regional community work group organizations that served that county. And this is based on our organizational scan. So it's like the publicly available data. So for example, the gray color means, according to the scan, that no regional community work group organizations served that county. The light blue color means that 1 to 2 organizations that were involved in the work groups served those counties. And then as the blue color gets darker, it means there were more work groups serving those areas. So you can see that there is a range in sort of saturation across the state. And you can see that there is service across the state. And even though there were some counties that didn't have work group representation, the statewide task force organizations were representing or working in those counties. And we were looking at this to understand the geographic distribution, but also as a way of thinking about kind of channels of dissemination, like where was information potentially going throughout the work groups and the statewide task force. And it may not appear this way because of the size of the counties that you're seeing, but 70% of counties across Pennsylvania were served by at least one work group organization. I think that's noteworthy too. 70% of counties had representation by at least one work group. Okay. A lot of that data was the secondary data we reviewed. What I'm going to show you now is based more on our interviews. So I'm shifting from the diversity and the makeup of the partnerships to what were some of the key ingredients that made this partnership successful, as well as some challenges, which we'll talk about in a moment. But although challenges existed and there may be a range in people's experiences, the feedback overwhelmingly was very positive about people's experiences in the work group and the statewide task force. I am not exaggerating when I say that some participants said that their involvement in this collaborative was the most prolific collaborative they've been a part of. I'm not exaggerating. Those are actual words that people, at least one person that I can remember said that. And again, there very well was a range of experiences, and we'll talk about that. But to do this across the state, to be successful in bringing in all of those community voices, to have meetings that people enjoyed attending, looked forward to, cleared their calendars for, didn't mind being a part of, that is something, because we've all been a part of things, right? And sometimes you're wondering what you're doing there, right? So we wanted to understand, well, what was it that made these partnerships successful in that way? Because lots of other entities across the country, right, across the partners that CDC works with, are doing work like this. So we found that there were facilitators kind of at 2 points of the partnership: at initiation, bringing people in to the partnership, whether it was statewide or regional, and then engaging them throughout. So at initiation, what people in the interviews talked about was conducting tailored outreach to bring people in. A lot of the folks that were charged with recruiting members to their work groups really knew their people and knew what they needed to do to engage them, to bring them in, to motivate them to become part of the partnership. They use their existing relationships and networks. So these were like well-known people in the community that were charged with creating the work groups or recruiting people to the task force. And then, their own skills and qualities, like they were respected, they were seen as authentic. So all of those things helped bring people into the partnership. And then once you bring people in, you got to keep them, right? And so there were kind of 2 buckets of facilitators that really helped there. One set was around procedures and logistics. So this was about the organization of the meetings. They're well run, they're clear, they're on time. Meeting notes are shared, there's recaps, they're accessible. So things were done to make the meetings accessible to folks, not only in terms of accommodations, but also scheduling and things like that. And then they were facilitated well. So those things matter. And I hope CDC heard that you have to fund facilitation. I hope they heard that, right? It doesn't just happen. It's a special skill set. And then there were cultural facilitators. People talked about the collaborative nature, that their ideas mattered, that they felt valued and respected, that they were unified under a common goal. A lot of people were coming in from different perspectives. They have different agendas, but they were working towards the same thing, and they could put their own agendas aside. So now I get to go to my favorite part, which is the quotes from folks. Are we doing okay on time, Rhonda? It's 9:40.
Maybe 2 to 5 more minutes, Gabrielle.
Goodness. Okay. The way they respected each other, it wasn't just Sherry's project or Emma's project or Rhonda's project. It was everyone's project. There wasn't a power dynamic. It was whoever could get whatever done, got it done. And when you make people feel like that, it's pretty important stuff. So it's a statewide task force number. This is from a regional community work group. I'll just hit the highlights. The meeting group I was in was 100% engaged and respectful. The information we provided in our work group we knew it was going to the statewide task force. And this individual talks about how they saw the report and they could then see things that they said in their work group had reached the statewide task force, that it was heard and that it was captured as a recommendation. I have a lot more to share, so I can't do it all right now, but just to wrap up this piece around challenges and facilitators, I don't want to give the impression that everything was perfect and there was nothing to improve upon, because there's always room for improvement. So more so in the work groups than in the statewide task force, members did talk about how engagement could be difficult throughout the multi-year project because of limited capacity or organizational support or COVID fatigue and competing priorities. So one member says, I wish we could have had more people involved. What I'm going to highlight here is that the participants in the partnership, their engagement led to increased readiness to address health disparities. Their own awareness increased. They built relationships with key partners, breaking down those silos, reaching across the aisle. There were changes in their own practices. There were changes in the ways they were including folks with disabilities or thinking about disability inclusion. So it wasn't just that you created the reports, and that is huge, right? It's not, but it wasn't only that. It was also the people who were in the meetings were changed, and their organizational practices were changed. We're going to skip this. Here, I'm just going to, and I am almost done, but here, I'm just going to go back to this idea of diversity and bringing in not only diversity of sector, but in voice in terms of lived experience and role, like caregiver role, and just various elements of diversity. And throughout the partnership, we saw that this diversity played different roles. And I think this was really important, that it's not diversity for the sake of diversity, but that in the middle column, it was an ingredient to the success of the partnerships and the listening tours. People were thinking of things that they hadn't ever realized before. And the quote is, in the middle of the quote, you can see people were talking about their perspective, and it opened up something I hadn't thought about. That awareness within the partners and was really important and led to changes. And then again, it was a pathway to this enhanced capacity. Because of that diversity and partnership, because of the increased partners and strength of those relationships, people had new folks they could call on in the event of a challenge or a future emergency. Sherry already talked about this, the dawn. Here are some references highlighted in this presentation, and that is the end of this talk. Thank you. Thank you for letting me be a part of the work. It was a really wonderful experience for myself and my team.
Gabrielle.
Oh, I'm sorry. Can you speak just a little bit about Margot and her experience with accessibility there in your team as a result of working on this project?
Yes. So this was the piece I didn't include in the presentation, but Margot has a real passion for this work, and she did a deep dive into accessibility standards in things like reports and public-facing documents, and looked at all of the reports that were created from the ARC of Pennsylvania. But then, I think this is what you're talking about, Nancy, went a step further, because Margot prepared an educational workshop for our staff in our department so that we were informed about accessibility within the products that we're creating, about plain language, about the formats of the documents that we were using. So I think that in this project, there was very much this back and forth even between us, where we as evaluators were changing because of what we were learning from you. And that doesn't always happen. So that was pretty special too. And that's just one example of how that happened within our own department. Like things like colors and, like even our logo is probably not the colors, there's not enough contrast. So, our eyes were really open too.
Gabrielle, thank you. Thank you. Thank you. Let's turn to some more examples. And colleagues, I'm afraid we're going to be tight on time. So just one or two examples of an outcome or an activity. Maureen, on behalf of Lancaster Lebanon Dauphin.
Yeah, it was fantastic. And the collaborations, the two things we did to highlight in this, there was so much more, but we were able to do 2 health fairs, bringing together about 30 vendors at each participants, over 70 participants that came, and were able to talk to the vendors directly. And the feedback was, it is so hard to access sometimes the agencies that provide our services, that having this health resource fair was astronomical, and everybody's asking, so we will keep doing it as an agency. The second highlight was to be able, through some of the outreach we've done, to be able to speak to Penn Medicine, LGH, and the DEI ambassadors, which brought together over 100 providers to allow me to speak about disability, how a medical provider can be more disability friendly, some of the barriers our people face when they are receiving healthcare. And it was just amazing to have that door opened. And the only reason it was opened to speak to the Penn Medicine providers, and like I said, over 100 of them, was because of this grant. So we did electronic billboards. We did so much else to promote this work, but I know you're short on time, Rhonda, so I'll let the others speak.
Maureen, thank you for your leadership. Thank you to your colleagues. You know, partnerships and that outreach and learning is a part of the work that we could never take away. It's so significant. Thank you. Michelle, highlights from Armstrong, Indiana.
Good morning, everybody. Yeah, so I did prepare a couple things, but I will wrap this up very quickly. So I think one of the biggest things too is that connection with partnerships. You know, the work group that we had was everything from legislators to IEP professors to ID providers. So it literally brought minds together that normally would not be in this room. And that was one of the significant things that happened. And so connecting those minds and talking about these barriers and solutions that to Gabrielle's, thought that, they may not have thought on these levels before. And so it's getting those minds to be aware and making sure that they understand that, these things are out there, they're affecting this community. And if when we do tackle them, it saves lives. So that's actually the number one goal, right? So out of this initiative, we developed vaccination clinics here at the ARC. We were the only nonprofit in a bi-county area to do that, bravely. But quickly learned that dental health was such a disparity in this area, creating dental health clinics. We now have that once a month here at the ARC. And we'll continue to provide that as long as we possibly can here at the ARC. We are partnering with local hospitals to bring mobile clinics to the ARC, health clinics, and then healthcare training clinics, learning about diabetes and preventative care. So it's making sure that the barriers report, the solution report, that concrete ideas come out of that, and then action comes out of that. So the action is the mobile healthcare. The legislators also listened to the disparities in the sense of the tech, and worked really hard in our area to bring Wi-Fi to areas that did not have tech and could not utilize that telehealth during the pandemic. So it's also about affecting rural health, which we are here in Armstrong, Indiana County, and elevating the quality of care and the access to care. So thank you.
Minds together that will have never been together before, and clearly actors. Thank you, Michelle, for such drive and change. And thank you to your colleagues. Sally Jo, your work up in the northwest corner with Allegheny, Beaver, Butler, Lawrence, Erie, Westmoreland, a few highlights.
Yeah, go super quick. I'll refer to that region in the Western corridor as the Magnificent Seven. Real quick, to quote Meghan Trainor, and it shows how pathetic I am in my music taste, it's all about the bass. And we built an amazing one of hundreds upon hundreds of folks from various sectors, persons with disabilities. It was cross-disability and focus, health sector, education sector, nonprofit sector, faith sector, the whole deal. And the neat thing about the base, super quick, is they're a group that's still existing and doing, and that you can rely on them. When I call up and say, hey, you want to weigh in, they weigh in. Case in point, when we had got word from a local group here in Pittsburgh about looking to influence the 504C piece, as well as the lack of accessible medical equipment. Kid you not, in a week, I talked to over 100 people. And that was throughout the region because we built trust and we built a strong base. And it's a good group. I will do a quick shout out. Love the Elks nurses. They were amazing. And the community health organizers from the Department of Health were absolute champions. We met, continued to chat and do so. And then out of those Magnificent Seven, started a Southwest Health Advocacy group that involves individuals from 12 counties. So boom, here we are. So no, great group, good. And it was just the passion, and they're involved and wanted to continue the work. So that's me, and go Buccos.
The base keeps the band together. Way to go, Sally Jo. Keep up your great leadership. Thank you to your colleagues. Daryl Lynn, a few highlights from Westmoreland, Washington Green.
Yes. Hello, everyone. Just want to first say thank you so much for the opportunity for the ARCA PA. And it's just been a great experience being able to open so many doors of communication and enhance relationships with healthcare providers, raise that awareness, and really allowed us to look at those barriers and figure out how we can take action. So we are part of the health advocacy team with Sally Jo. So we'll continue our work on that and ensure that we can take some action. Just a few things that we've been doing with the ARCA Washington is we're trying to build our healthy living group for self-advocates. So we actually had this group prior to COVID, and then it went away. So it's a great opportunity to bring it back. So we're really just want to hope to get people at the table, talk about, educate, and give them the information that they need for whether it's looking at telehealth and how to use technology to make the most out of telehealth, how to speak up at your doctor's appointments, learning about nutrition, and just the physical and mental and overall well-being. So that's our plan to move forward and educate self-advocates, as well as educating the healthcare professionals. So like I said, we've had so many great relationships built from this. So the hope is to get out to physician's office, which we've already have been doing, but they are looking at kind of advertising some things related to the ARCA Washington and just some disability awareness things in their digital advertisement in their waiting rooms. So I think that's pretty cool to get out there. So we will definitely continue the work.
So appreciative, Daryl Lynn, of the work that you've done and your colleagues there in that area of the state. I love the soundbite. We will continue. I'm sure you will. Thank you. And let's go to Shane. So much going on in Philadelphia before this project and through this project. Shane, share with us.
Hey, good morning. Yeah, I think the biggest takeaway has been we had a lot of academic partners and healthcare providers in our groups. And we had been doing a lot of the healthcare advocacy, I think, with individual universities and getting a lot of people education around interacting with our patient population. But this group really started to build our reputation around coming in as like consultants around curricular development for the universities at a bigger scale. So I think that was one of the biggest effects that we've seen really kind of snowball into a lot of momentum, where we were able to go to our partners and say this work is happening from other disability advocates through the ARC network across the state. And it started to position us as advocates as reputable and reliable teachers to come in and bring our population into healthcare education and into healthcare policies and so forth. So that was still an effect that we are seeing today, and our group has been very tight knit. We have invites back now with all of our partners to continue the work out of our health advocacy program. We have I think 5 different guest lectures already on the calendar for the fall across a number of universities. So it really kind of established more of a foothold in being recognized as people to be bringing into any of this work, anything around accessibility for people with IDD. People have begun to look to our chapter and our group of individuals in our regional work groups.
A well-deserved reputation, Shane. Thank you for your leadership. Thank you to your colleagues. Voice was such an important part of this project. It is a key part laced throughout our recommendation. And the primary recommendation was voice. Listen to people with lived experience. I turned to Brian, who was such a key leader in this work at the steering committee, active at the statewide task force and at the regional level, and continues with us in the Disability Health Action Network leadership level. Brian, help us now.
Sorry, one other statement, because this just happened.
Shane, something? You bet, buddy.
Sorry, thanks. This actually just happened on Monday of this week. But in one of our presentations, just that from our work, from the research, and then from our work as in our regional work groups, we know that people with IDD, aside from seniors over 65 that had the highest mortality rate related to COVID-19, our population was second on that list, which is terrible. But when we go out and have these conversations with individuals, people are still completely unaware of that fact and that reality. So I think this is kind of bringing it back to the funds related to COVID-19 and the research around that, just not to lose that talking point and not to use that as something that, honestly, when we bring it up, everybody in the audience is shocked and it's something that they've never heard. And if we don't say it, they're never going to hear it. And so to really keep bringing this work back up as the years kind of move along is going to be really important to keep grounding why this is an issue, because we've seen it in real time. This is not something from years past. So that just happened in an audience, and you can tell that they're moved when you do say that, when you just point out, aside from people over 65 who had the highest mortality related to COVID-19, this was the patient population with the second highest mortality rate. And everybody's saying, is taken back, and then kind of using that as the launching point for why this is so important, really gets people to buy in. So I think bringing it back to why this work started in relation to COVID-19 is still important to keep bringing up wherever we go.
Thank you for putting that thought in our hearts and our minds as we close here today, Shane. The theme that we tried to frame today is elevated attention, elevated action, miles to go. In fact, yesterday we joked about orbits around the Earth to go yet in this work, and your point illustrates that. Brian, help us with acknowledgements for this project.
Perfect. Hello, everyone. I'd like to acknowledge the CDC and Department of Health for prioritizing disability health equity. They did a great job and gave us the funding, and we're so thankful for that and all the opportunity that we got. And now I get to thank somebody who didn't want to be thanked. I get to thank Sherry Landis. I'm gonna make a quick thank you to Sherry, because not only did she help us lead this, but she helped me get a self-advocate on the ARCA-PA board of directors. She sent me 2 emails about that yesterday. So she is a leader in self-advocacy in more ways than one. But, so thank you to all the ARCA staff as well. Hey guys doing? Thank you to Rhonda and all the administrative staff as well. And Sherry was supposed to say that. Sorry, Sherry. Go ahead.
No, Brian, thank you so much for the recognition. It was an amazing team. I gave a shout out to Rhonda, but Nancy Shirley makes the world go round here at the office. Kathy Roschemeyer, who is also on the call, thank you. She was our boots on the ground, finding individuals, to talk. Tracy Gross-Fritz, she's the money gal. She makes the world go around with the money. And our dear Emma Nolan, who is no longer with the ARCA-PA because she is going to law school, but what a tremendous help, and could have not done it without this team. And Rhonda, bottom of my heart, thank you so much. I also have to recognize Seisler Media and Issue Advocacy for our media campaign, great partners. Nicole Brandt Communications, she's the one that put together these beautiful reports. Our e-learning module designers, our language translation and interpretation services, and Gabrielle, the Public Health Management Corporation, for your project evaluation and the great new, not only partnership, but for your friendship as well. It has been wonderful to get to know you and your team, and look forward to continued work with you as well. Thank you for our steering committee, Kristen Ahrens, Maria Brandt, Rachel Cook-Foster, Brian Habermel, William Piaz de Mello, Mike Greer, Luz Hernandez, Doug Trahey, and Jeremy Yale. Thank you, thank you, thank you. And really, thank you for all of you. Thank you for the regional community work groups and the many presenters and experts who made this even more enriching through different learning modules and our lunch and learns.
And let's go back to Brian.
All right. Now, thank you to our regional community work groups, our local chapters for growing partnerships in regional health and disability communities. Thank you for helping us identify barriers and have recommendations. Good deal. Is that me too?
Yes, please.
All right. Thank you, statewide task force, and for translating our findings and reports into action. Thank you for your state level participation. This was my first opportunity to be part of a statewide anything. So I'm like, wow, if this is possible, then what else could be possible? So
talk about a reputation, Brian. We all know now.
I don't need a reputation, but
great statewide leader.
Oh, that's nice. But yeah, so the biggest thing is to thank over 400 individuals with disabilities, caregivers, healthcare professionals across diverse disability, ethnic, rural populations who participated in interviews and listening sessions. Your voice matters. I'm so excited with the state of PA because I got to meet a self-advocate named Sean, who was an intern for the state of Pennsylvania, and he got to come up to talk to my self-advocacy group, and it was so wonderful to hear his story. And then so self-advocacy is a statewide thing, so please get involved. Thank you.
Thank you, Brian. We promise to send the video, as well as I think we can share this video, right? For all of you who would like to recap or maybe show it to your board of directors or other groups that you're involved with. Please remember our Disability Health Action Summit. Thank you. It's kind of emotional. It was amazing. Thank you so much. We had a dream in the very beginning, and this crazy idea, and I brought several of you along with us. It's for planning, and then I got even more people involved throughout the state. So Thank you so much. We will continue this work because it matters. So thank you.